My name is Liz Juneau, and I'm your host for Wellness Wednesday at Westside. And Wellness Wednesday is an outreach of the Westside Presbyterian Church intended to help all those who are on a journey toward wellness. We are a collaborative community seeking to integrate body, mind, and spirit. And we are committed to introducing you to people and to practices and to ideas that benefit the whole person for the whole of life. And I'm just thrilled this evening to be able to present to you Dr. Dan Van Engle, as a board certified neurologist with a practice here in Bergen County in Ridgewood and with access to Valley Hospital. Some of you may know him through his work for over 45 years. And how many of you have ever sat in a dark room praying that your head would just calm down and that your migraine would go away? Let's see by a raise of hands. I suspect many of you have been in that position before. It's millions of people suffer from migraines, and it's, I think, something that many people have been on their hands and knees begging for relief. And we are hoping, Dr. Dan, that you can offer us just some insights and ideas and field some questions to offer a little relief. So thank you for being here this evening, and I will let you take it away.
Thank you, Liz. Thank you for inviting me. Just a reminder, my name is Dan Van Engle. I practice in Ridgewood. I'm at Valley Hospital. I work with the neurology group of Bergen County, and I've been in practice for over 45 years. And I know what a lot of you are thinking is, how is this possible? He looks so young. And I think so migraine is what they call an episodic disorder. It's centered around a headache, which is often very disabling, as some of you know. It's very common. It occurs about 12 to 15% of the population. It's more common in women than men. It usually starts in late teens and tends to peak around the 20s. And by the 40s, most people have had them by then. And then it tends to taper off as you get older. That's probably the only good thing about getting older, is losing your migraines. It can be inherited. So very often you'll see that the parents have had similar headaches to their children. I'm going to talk about the description of the classical migraine, the textbook migraine that you can read about. And there are 4 phases. There's a prodromal phase, the aura, the headache itself, and then the postdromal phase. It's what happens after the headache is clearing. In the prodrome, people have a sense that they're going to get a headache. They just feel it. Now, I don't know if anyone has ever seen the show Sanford and Sons. Fred Sanford is a junkyard dealer, and when he gets upset, he grabs his chest and he says, "Here comes the big one." He looks up at his wife in heaven. He goes, "Here comes the big one, Elizabeth." I'm, thinking that he's going to die. People have a sense that it's coming. The next part is the aura, where the most typical symptom there is a visual aura, where there's a loss of vision in one part of the field, and it can be scintillating or sparkling. It can be a zigzag pattern, and it tends to move around. And this aura typically lasts about 15 to 20 minutes. When that subsides, the headache starts, and the headache typically builds up. It's a one-sided throbbing pain. It's usually associated with nausea and vomiting sometimes. People hate what they call photophobia. They don't like light exposure. They can't stand sounds or smells. And as Liz pointed out, they often want to go into a dark room. And they'll tell you that, "I want to go into a dark room." As the headache subsides, then you can feel like you've had a hangover. You just feel tired, headachy, just irritable, and it can last for a while. So what I told you was the textbook classical migraine. The truth is, most people don't have that textbook case. They usually have some variation on the theme. In fact, most people just get the headache. They start just feeling a head pain in the back of the head, and it builds up, and then they feel sick. Sometimes it awakens them from sleep. They actually get it in their sleep. Some people get the aura without the headache. They'll get a visual symptom where they see a sparkling light in front of them, and it builds up, and then for 20 minutes, and then it goes away and nothing else happens. Some migraines can be associated with other things such as vertigo, dizziness, speech problems, and weakness. Those are not so common, but they do occur. The migraines can have triggers. the most common things that can bring on a migraine, the most common is stress. In fact, I see a lot of people with migraine in my practice, and when they come back and say my migraines are worse, the first question I ask them is, what's going on in your life? Because very often stress will make the migraines worse. It doesn't cause the migraines. It just makes them more noticeable, more prominent. Certain foods can do it. Chocolates, red wine, cheeses, anything that you might enjoy will probably trigger a migraine. We don't get migraines from spinach and asparagus. I don't understand that. Certain hormonal changes will do it. Also, a lot of women tend to get them around their menstrual period, and sometimes during menopause, women may have more frequent migraines. Sleep is very important, and so a lot of people will get migraines when they can't sleep well. That's often tied into stress, but sleeping poor sleep habits can trigger migraines. Certain smells can do it. Head injuries can also make it worse, or even bring it on. People who have had a car accident, bump their head, can develop migraine headaches at that time. So when we talk about triggers, those are sometimes the things that you can do to prevent migraine by avoiding them. So people have learned to avoid certain foods that bring it on. The truth is, most people don't recognize triggers, but if you do, it's important to know that. So that's the bad news. The good news is we can do a lot for it. There's a lot of treatments available that will control or stop the headaches. And when we talk about treatment, we talk about the acute treatment and also the preventative treatment. In other words, you can take a medicine right away and block the headache or abort the headache. You can also take a medicine every day that prevents it from coming on or reduces the onset or the frequency or the severity. So when we talk about acute treatments, I'm going to go through a list of different medicines that do it. The key here is to take them as soon as you recognize the headache. As soon as you sent the prodrome or the aura, you should take the medication so that you can prevent the headache from becoming bad. So there's a whole list. Let me go down. Some people do very well simply by taking a drug like Advil or Aleve. Or even Tylenol. I have a few patients who do very well with just those drugs. The other over-the-counter medicine is called Excedrin, and it's a combination of Tylenol and aspirin and caffeine. And again, for some people, that works very well. Then we talk about prescription medications. The most common ones are called triptans, and the most popular one is called Imitrex. But there's also a drug called Zomig, another one called Maxalt. These drugs come in different forms. The most common being that is swallowing, taking a pill and just swallowing it. Some are pills that you dissolve in your mouth and swallow the saliva. Others can be injected into the muscle or into the skin, under the skin rather. And some can be inhaled. There are two products that you can inhale. The advantage there is that if someone is nauseated, you don't have to worry about swallowing a pill because you won't lose it if you throw up. So those are the advantages of what they call parenteral treatments. So those are the triptans. Some people will combine Imitrex or the triptan with an anti-inflammatory like Aleve, and that sometimes works even better. And then there are the newer ones called CGRP antagonists, and these are the drugs that work against a neurotransmitter around the brain and help block the headache. And the two newer ones are called Nurtec and Ubrelvy. And you may have heard of those because they're being advertised on television. So it's ubiquitous. The key again is to take it early. As soon as you recognize that you're getting a headache, you can take the dose. With most of these drugs, you can repeat the dose 2 hours later if you need to. And then you can even take it the next day if the headache persists. So the key is to be aggressive with these drugs. But there's a lot that can be done to prevent the migraines, other than avoiding triggers and trying to get rest and living a quiet lifestyle. Of course, it's true that even if you do everything right, you can still get migraines. It doesn't stop you from getting them. So the medicines that we use a lot of these medicines that we use to treat the migraines came out for a different purpose. So, for example, beta blockers, which are used to treat blood pressure, are very good for preventing migraines. The one that is most commonly used is called Inderal or propranolol. And other ones include antidepressants such as amitriptyline or Effexor. These obviously they were antidepressants, but they seem to work very well for preventing migraine. And then there are certain anti-seizure medicines that work well too, topiramate or Topamax or valproate. In general, when we start these medicines, we start at a low dose and we build it up slowly to see what happens to the headache frequency. The decision to use a preventive medicine depends on how often the headache occurs. And we talk about headache days, not headaches. So for example, if you have one headache that lasts 4 days, that's 4 headache days. So we count the number of headache days that you have per month. And in general, I find that if you have more than 4 headache days a month, you should probably start a preventative medicine. And generally we start low and then we build up. And you see you try to use as little as possible to control the pain. And we look at the frequency of the headaches, the severity, and the duration, and see how you do. The newer drugs are called those CGRP inhibitors, and these come in different forms. The earlier ones were injectable into the skin, under the skin, that the patient gave to themselves once a month. And this includes Aimovig, Emgality, and Ajovy, and they're very effective. There's an infusion that you get into the vein every 3 months called Vitepi. And then there are some the oral drugs are just out called Nurtec and Calypta. And these are drugs that you take, well, the Nurtec you take every other day, the Calypta you take every day. And again, they're used to prevent migraines. Other things that you can do include Botox, where you inject Botox around the scalp, and it's given every 3 months. It doesn't stop the headaches usually, but it makes them less frequent. And then there are certain non-pharmacological treatments like biofeedback or relaxation techniques, things like that. The other problem with migraines is that people often get terrible nausea, and sometimes the nausea is more troublesome than the headache itself. And there are a lot of medicines that can prevent that or reduce that. Some that are given by mouth, and some by injection, and some even prevent them as a suppository. These include Zofran, Reglan, and Compazine. So that in a nutshell is a survey of migraine and how we treat it. I think at this point, if you have any questions, we could start, because I've basically said what I was going to say. Liz, are we okay?
Yes, thank you. Okay, so somebody is asking, does acupuncture or acupressure have any bearing with the migraine treatment? I think the question is, can you do them together? So
Yes, you can try. Acupuncture is quite safe. The only problem is the cost. Most patients I find who use acupuncture for pain, they find that it doesn't last very long, but it can be effective for pain. I'm not sure it helps migraine too much, but it doesn't hurt to try.
So it could be complementary then, yes.
Yes, exactly.
And can you say a little bit more about the biofeedback and why you think that might work?
Only because it helps people relax. People who are very anxious will have more headaches, or will have more headaches when they're anxious. So it trains people to relax and calm down, and hopefully it reduces the number of migraines.
So it's just mostly for the relaxation. And do they know why people who have a tendency to have difficulty relaxing, because everybody has difficulty relaxing at some point or another, but not everybody would tend toward migraines.
No. Migraines is a physical phenomenon. It's just made worse by tension, and it's not always the case. But and just because you're a nervous person doesn't mean you're going to get migraines.
Right. But it's just somehow the two to go together. Can you speak a little bit about visual migraines?
You mean the ocular migraines?
This is being asked by another doctor, so I'm not sure. This is Dr. Thomas Alborn, who would like to have that described. So I don't know if he wants to clarify what he means.
No.
And you can certainly unmute if you want to ask out loud. Tom?
I get visual migraines, but I don't get the headache or aura.
Well, actually, the visual migraine is the aura. You just don't get the headache with it, and that's very common. People will get that's the typical aura where it'll be like an area in your vision that is blocked by either nothing, or just a black, or it's like a sparkling or zigzag pattern, and it expands typically, and then it goes away usually in about 15, 20 minutes. And that's a migraine phenomenon.
And is it related to your vision? Like perhaps you need to have your glasses checked?
No, no,
or-
no, no, no,
No,
no,
okay.
no. It's a brain phenomenon. No, I mean, you could, and if it happens frequently, you might, you can consider taking one of those preventative medicines, but most of the time it's not disturbing enough to take something every day.
Okay, okay. Now, one of the medications you mentioned was the over-the-counter Excedrin, which you said has caffeine. So is caffeine something that could help a migraine?
Yes, caffeine is funny. Some people actually get a migraine from caffeine, although most people find that that it helps their migraine. The other thing about caffeine, I didn't talk about this, but I should. There's a thing called rebound headaches. I'm a good example of that. I drink coffee every morning, and if I miss a cup of coffee by 3 o'clock, I'll have a terrible headache, which goes away as soon as I take coffee. I drink a cup of coffee. So caffeine can help reduce headaches. And for some people, they just have to drink caffeine, otherwise they'll keep getting headaches.
Okay,
Wow.
unless, yeah.
I have a
That's different
question.
too.
I have a question.
Okay, go
Um,
ahead.
My daughter, Linda, has a rare disease called Moya. I don't know if you're familiar with it or not. It's a very rare disease that we believe she inherited from her dad, but she does get migraines, and Linda's had 3 strokes already, plus one that she recently had a week ago. She's home now, and when she does get a migraine, sometimes you will have the same symptoms, almost as if she's having a stroke.
Okay. So I'm not sure that the Moya is necessarily causing the migraine, but there is a condition called hemiplegic migraine, which often is inherited, and where people get a stroke-like symptom with the headache. Usually, the stroke symptoms go away, but they look like they're having a stroke. They'll be weak on one side, or they may have trouble speaking, like any stroke patient.
Well, it's really, yeah.
And occasionally, on rare occasions, it's permanent. It doesn't go away. That's not typical, and it's not common. We don't see that very often.
I mean, are you familiar with Moya? Have you ever heard
A
of
little
it?
bit. I mean, it's a blood vessel disorder of the brain, and you see it's often seen in children actually, and it can cause strokes.
Well, Linda actually developed a Moya in her 30s.
Yeah.
She had no symptoms of it at all when she was a child, so it can also come in adults around the age between 30 to 35.
No, it presents in adulthood, but it's probably something that she had at birth.
Yeah, she had it her whole life. We just have to keep an eye on her brother and sister, obviously.
Right.
Yeah. Okay. So another question, somebody is asking, they developed migraines during menopause. They are now postmenopausal, but are continuing to get them, but that's when they started. So any kind of
Well, nobody
help with that?
nobody follows the rules,
Oh.
The medicine is full of exceptions. So, like I said, most women will find that after menopause, the headaches go away or get much better. But some people continue, and every case is different. And what I had an interesting case once. I saw a woman who was, I think, 54 years old, started getting migraines, which is very unusual. In fact, when that happens, we worry whether they're having some stroke problem. Turns out her mother had a similar story. She had started getting migraines, same headaches as hers, in her 50s. So they can be very different in families, and there are a lot of exceptional cases.
Okay, so this person is just exceptional, and you would just
everybody is.
recommend, yeah, we're all special. And you would recommend this, the regular protocols that you had suggested.
I'm sorry.
You would recommend the regular protocols that you had recommended for this person, even though.
You mean the various treatment programs?
Yeah. Okay, so another question, many of the medications that you recommend are contraindicated when you are pregnant. So do you have recommendations for a pregnant woman with migraines?
Yeah, that's a hard one because there's not, I didn't talk about a drug called Furacet. I should have mentioned that. It's like Excedrin. It has caffeine and it has a barbiturate and either Tylenol or aspirin. The Furacet has Tylenol, and that's a very safe drug in pregnancy. It's an old drug. It's been around a long time, and it's still effective, and I have a number of patients on it. I forgot to mention it, actually. So that would be probably the only safe drug that we can use during pregnancy.
What's that called?
Well, it's a Fioricet or Fioricet.
Okay.
It's butalbital is a barbiturate.
Okay. So hope that person was able to hear that. Does long-term use of Imitrex cause cognitive issues? And if so, is it reversible?
I'm not aware of that. I didn't know that that existed. I should say one other thing. The medicines that we use to treat migraines acutely should not be used on every day because you can get rebound headaches. An example of that was the Excedrin. So you have to be very careful about using these every day. I'm not aware that any of these medicines cause dementia or cognitive problems.
Okay. Also concerned about topiramate that might be bad for your liver over long-term use.
It's possible. That's actually my favorite drug for preventing migraines. And if you take too much of it, you can have cognitive issues, which is reversible.
Okay.
But all these drugs can, you have to watch carefully. Anytime you prescribe medication, you have to look for side effects. You might want to check blood tests periodically. Any medicine can cause trouble.
And particularly for your liver, I guess this person is
I'm not sure about that. I have to, I don't know the answer to that for sure.
Okay. Somebody is saying that she finds that fiorinol and butalbital
Right.
relieves her migraines, but several doctors have said that it's not an appropriate treatment. She wondered what you thought.
Well, I disagree with that. I think it is. The problem with that drug is that it's prone to I wouldn't say abuse, but to be used every day. So unfortunately I have a number of patients who started it and have daily headaches and just cannot get off get off of it. So for that reason, it's best not to use it. But it is a good drug, and I have a number of patients who use it periodically when they get a migraine, and it is appropriate to use it.
Okay. What do you recommend for a person who's been struggling for years with migraines, but has had through a family history, but cannot take triptans because they've had a stroke?
Well, there are other drugs, and you could try those newer ones. They're called the CGRP inhibitors.
CGRP.
CGRP.
Okay.
Well, I'll give you the names. The Ubrelvy and Nurtec.
CGRP inhibitors.
CGRP.
Okay, just putting that down so somebody, okay, and then somebody, let's see, I'm sorry, there's a lot of great questions here. I want to make sure I don't miss any. How much stock do you place in using the herb feverfew for migraines?
I don't think there's any proof that it works. I mean, I don't think there's any danger in trying it, but from what I understand, it doesn't do much.
Okay, and then along those lines, somebody's asking about CBD or marijuana. Have you ever?
As far as I know, I think people will find that marijuana is going to be used for a lot of different things, and we're still learning. But I don't recommend it. But I suppose people do use it and they find it helpful. I don't know the answer to that for sure.
So you haven't prescribed, because I know
No.
you can prescribe it. No. Okay. So can long-term use of Imitrex cause strokes?
Not that I know of.
Okay, that's good. What has the medical community learned about migraines that might provide insight into behavior, environmental, nutritional opportunities to treat or even prevent further migraines?
Well, I think, I sort of addressed that. There are certain people who have sensitivities to certain foods. I mean, I mentioned like red wine or aged cheese or chocolates. So in that case, avoiding those things will help you avoid migraines. But most people don't get these triggers.
Okay, so, and there's not much, is there any more research being done on what might cause, like environmental impact, or they don't, not necessarily don't know?
As far as I know, no, I'm not aware of that.
Okay. So, and then, so the nutritional piece of it is that you were mostly suggest that a person avoid the foods that they
Right, that
feel
cause a
might be
headache.
triggering their migraines.
Right.
Yeah, right, okay. How would you decide if someone would benefit from Botox treatments for a migraine? Is there a particular kind of person who would be a good candidate for that,
Well,
for
okay,
Botox?
so part of the how we decide to use this drug depends on several factors, including underlying problems. For example, if you have asthma, you can't use beta blockers. If you have kidney stones, you shouldn't be on Topamax. As I listed these drugs, as I mentioned, the later ones are more expensive. So very often you really won't start with the newer drugs because of the cost, and insurance companies won't cover it. So we tend to start with the easier ones, the less expensive ones, safe to say that, which are also very effective. And then we go on to the others. Am I answering your question?
I don't know. The person who's asking can certainly pipe up. I think they just, and because she also wants to know if you have any thoughts on supplements such as magnesium or CoQ10 for prevention.
Yeah, no, it's my understanding that they don't really add very much. Again, there's no harm in trying, but I don't, it doesn't do much as far as I can tell.
Okay. What does CGRP stand for?
Okay, calcitonin gene-related peptide. It's a protein that is near the brain and stimulates the skin around the brain. Presumably that's how it works. And these block that peptide.
Okay. Do you know anything about Baja Gold mineral sea salt?
No.
I told you that this group loves to just check on all the alternative things because we're always looking for ways to try to help ourselves, which I think
No,
is,
I understand.
yeah. That was something I actually hadn't heard of, and you hadn't heard of it either. So somebody's saying if I take 2 Advil at onset of the aura, it cuts the symptoms for me. My migraines occur at the resolution of a stressful period, and I do have the feeling of premonition prior to the onset of migraines. Okay, so that's sort of a public service announcement for anybody else. So it sounds like this person has had to become very aware of what works and what doesn't. So it's,
Right.
would you recommend, so you do recommend if right as you're about to feel it coming on, if you take the over the counters, it might actually help.
Right. Yeah, they do.
Okay. Amovig once a month and Topramate daily works well for me, and I've tried everything, and I've had migraines since I'm 17 and I'm 57.
Right.
Okay, so then that's a gentleman. So there goes that theory that it's mostly women. This poor gentleman has been suffering for quite some time.
Yeah, I'll tell you a story. I had a patient who came to see me about a year ago. He was in his early 70s. He'd had migraines almost throughout his whole life, and he was seeing everybody in the city, and nothing really worked. It just around that time, this new drug Nurtec came around, and when the new drug comes around, the drug representatives always leave samples. So I said, "Here, try this one, see if it works." And he calls me back and he goes, "Doc, you're a genius." But I'm not a genius. I just have to be at the right place at the right time. So sometimes you find that medicine works very well.
Mm-hmm. Is that uncommon for something to be lasting for that many years in a person?
It can. No, it's not. Oh no, people can have it for many years. Sure, it can be lifelong.
Yeah. My migraines often seem to be caused by changes in the barometric pressure. Could you comment on that?
Yeah, oh yes, actually, yes. I probably didn't mention that, but weather changes can affect the migraines as well. People can when it's raining. I have a lot of patients who tell me that they'll have more headaches when it's raining. And that's probably related to the barometric pressure.
Huh. So would be living in a different kind of climate particularly help?
Sure.
Yeah. Warmer, colder, drier?
I'm not sure. I would think drier,
Oh,
but I couldn't answer that.
maybe just a dry, consistent climate. I don't know where that would be, but somebody who suffered for years has said that magnesium and CoQ10 has helped her.
Okay. All right.
She has
You
felt
know,
that,
it's worth a try. I don't, it's okay.
yeah, yeah.
There's nothing wrong with that.
Yeah, and some people who have found that they weren't able to tolerate medications, I think then end up trying to turn to these other kinds of things just to get
Mhm.
some relief. Sleeping
Right.
in a dark room, even peppermint oil on the temples,
Okay.
which I suppose can provide a cooling. There's a lot. I know even in the hospital they try to use some of the essential oils, lavender, to help people sleep and calm down.
Right. Right.
I noticed that they're doing that in the sort of complementary medicine area in the
Mhm.
hospital. So,
Sure.
do you recommend that patients have a bubble study test to determine patent foramen
Okay.
PFO?
All right. So I didn't bring this up either, but people, this is a condition where blood from one side of the heart goes to the other side, and people with that condition. It's called patent foramen valley. Are at a higher risk of migraine. So I do not test everybody with migraine to look for this PFO. It would be expensive and prohibitive. But if they discover it and they have migraines, then that might be a reason why you want to correct it. There are things that you can do to correct it surgically by putting through a catheter thing that blocks the passage between the two chambers of the heart. But we don't test for that routinely. It's not necessary.
So that would only be if the doctor determined that that might.
Yeah, usually when
Yeah.
people have that condition, they either have a murmur or they've had a stroke, and then they find that they've had a shunt from right to left.
Okay.
And then they can get, so in other words, they'll have a clot in the leg, which will go instead of just the lung, it'll go to the brain instead. And then in that situation, you have to correct it.
Mm-hmm.
But there is a correlation between migraine and that condition.
Mm-hmm. So this is interesting. Somebody says they get terrible headaches if they overheat from prolonged exercise or being outside on a very hot day. Is there any way to prevent this other than to stay inside or not exercise, which they clearly don't want to do?
Well, there are people who get migraines from straining. There's it's called exercise-induced migraine or exercise with headache. For those people, sometimes if you take an anti-inflammatory called indomethacin, you can prevent the headache from coming on. But I'm not sure that would work with him, but it's something worth trying. That might be worth trying. Or just take start one of the migraine preventatives and see if it helps. Again, it's all by trial and error. When we use these medicines, we start with one and see how you do. And then if it doesn't work, then we get off and go on to another one. And sometimes it takes a while before we find the right combination of drugs that works.
Mm-hmm, mm-hmm. Somebody is actually, and this might help this person who, somebody was recommending that they have like an ice pack. It's called a migraine ice cap. It's like an ice pack for your head. And they find that it's very, very effective. And I'm saying that out loud to suggest this to all of you because that seems like something you could easily do.
Yeah.
The other thing that I have to say from 5 years of hosting these programs is that virtually every single medical professional who's come on here told us that we were dehydrated and that we actually just needed to drink more water. So I cannot say that that will prevent a migraine, but I think if you're hot on a hot day and you're stressing yourself out, maybe have a good slug of water. What do you
That's a
think?
good idea. Yeah, no, I agree. That's a good idea. But that's good even if you don't get migraines.
It seems like, according to a lot of the nutritionists we've had on here, most of us are dehydrated. So
Yep, and I'm doing that now.
there you go. Okay. Lack of sleep, people say, is a direct high. She called it a direct highway to the migraine is lack of sleep. So is that connected to what you were talking about in terms of
Yeah.
stress?
Yeah, everybody's different. Some people like that with that person, it's probably her trigger. That if she doesn't
Okay.
sleep enough, she'll get a migraine. That makes sense.
And there's another vote for peppermint oil taking the edge off.
Sure.
Okay, guys, got to go get your peppermint oil. I believe my headaches are correlated with the ingestion of tyramine. Aged cheese is an example. Oh, do you have any thoughts on tyramine as a trigger to migraines, which I think you mentioned aged cheese?
I suppose, yeah, it probably is. I don't have any experience, but sure, why not? Yeah.
Is tyramine, I'm sorry if this person wants to speak out loud, but what is tyramine? Is that
Tyramine is a naturally occurring substance in aged cheese, soy sauce, food that's been left over for a while, right?
Oh, okay.
Red wine that's fermented over time, right? And I
Oh,
and so, I've had headaches for a little while. I've charted my headaches, and there seems to be some positive correlation between the foods I just mentioned and the drinks and my headaches. And so I, went onto the internet, and tyramine seems to be the substance, again, naturally occurring, that causes the headaches. I was just wondering if Dan had any knowledge of that or understanding of that.
Can't speak about the tyramine, but all those foods you mentioned are typically seen as triggers for migraine. That's very common.
Yeah.
so, and perhaps that's the reason. Yeah. I mean, a
Yeah.
lot of times people will say with soy sauce or things, it's like MSG, but maybe it's actually this very specifically this
Yeah.
tyramine. So that's actually helpful for folks.
Anything that's fermented or aged, including leftover food that's been left over for too long, right? It starts to get this tyramine starts to be grow in it,
Wow.
and so that causes. So I can't eat food that's been left over for more than a day or two.
Huh. Well,
So,
thank you for
daughter,
sharing that.
Linda,
That's very
my
helpful.
my daughter Linda, every time she's had something like cloves, what's the other one that you can't handle?
Allspice.
Also, some kinds of seasonings could bring on a migraine with my daughter.
Yeah, so it could have that in there too. Other than head trauma, are there other neurological issues that should be tested for if you're finding reoccurring migraines?
Well, if you have atypical migraines or is something unusual about the migraine, you might want to investigate further with MRIs or other studies. But if you have a fairly typical picture, especially if there's a family history, I don't generally do any studies. I don't do any tests. But if there's something unusual about the migraine, yeah, then we will investigate further other things that can cause headache. Now, not all headaches are migraines. Actually a very common cause of headache is just tension. People just get a band across their head. They feel tightness in their neck. That's a very common, but it's not a migraine. It's what we call a tension headache. And there are other causes of headache as well. If the headache, there are certain things about headaches, if they're new, if they're getting worse and worse, if they're associated with any neurological symptoms, then you need to look into that. Because if not, don't assume that you have a headache, it's a migraine.
So can you remind us again, I know you started out, but now that we're talking, can you remind us again, just what's the difference between a traditional headache and a migraine?
All right, the tension headache, I mean, sometimes it's hard to distinguish, and sometimes you can have both. But the classical tension headache is like a band-like sensation around the head or a tension and tightness in the neck. And it's not associated with all these other symptoms like nausea, light bothering you, sound bothering you. And it's often correlated with stress. People will tell you, I'm in the office, I'm typing, and I got a headache, or something's going on in my life, and I'm getting this headache. So it's a different kind of headache. But sometimes people with migraines have headaches that are similar to tension headaches. And sometimes we will treat for migraine and find that they get better. So sometimes these quote tension headaches are really migraines.
Ah, okay. And then could you explain what a cluster headache is?
Okay, cluster is similar to migraine. It's a little different in that it presents a little, so people with cluster, well, it's called cluster because they come in groups. Classically, they come in groups. You'll be fine for a while, and then they'll sort of build up over a period of several days or several weeks. And then you may have one a day, let's say one every other day, one a day, two a day, and then it tapers down. The classical headache there is a knife-like pain into your eye. People describe it as like a hot poker being drawn into your eye. It sounds terrible. It's very brief. The headache doesn't last very long, but then you're left with the residual pain. The treatment for that is similar to what we do for migraines. Triptans often help those headaches, and preventative medicines help too. In that situation, a drug called calcium channel blockers can be very helpful.
Calcium channel blockers?
Yeah. It's medicine that you use to treat blood pressure and heart disease, but they can be helpful for preventing cluster headaches.
Okay. And so that's something, okay. Thank you. So, okay, so I think that we have mostly answered the questions that have been asked, but friends, we have a few more minutes. If anybody wants to unmute themselves if you have another question you would like to ask. Now is the time. And somebody is also just recommending that this ice cap is called Thera Ice Cap, and you can purchase it on Amazon. These are just helpful tips that people are offering to one another for you, for fellow sufferers, which actually sounds good to me, even though I don't get migraines. And somebody else is suggesting that the Chinese food headache, which I think sounds like we blamed MSG for it, but it does sound like this tyramine.
Or both.
Or both. Yeah. Very interesting. So sometimes these forums are very helpful because we share information with one another. Anybody else have any other questions or things you would like to share?
Yes, I have a question. My daughter gets a lot of migraines. Can migraines actually bring on a stroke?
Yes, in rare cases. Remember, I mentioned about this hemiplegic migraine, which is not very common, but people will sometimes get a weakness on one side of the body resembling a stroke.
Yes.
Usually they're temporary, but on rare occasions they persist and they'll leave you with a stroke, with a disability.
Okay. And then there's another question here about, do migraines seem to favor certain nationalities, people in certain backgrounds?
I don't know the answer. I don't know the answer to that.
In your experience, I haven't necessarily noticed that.
I see it in every, I see a whole wide range of people, so I can't say that.
No. It's an interesting question,
Yeah,
though.
it's a good question. I don't know the answer.
Okay. Well, Doctor, thank you so much for your willingness to share with us and give of your time. Friends, this will be recorded if you want to listen again or share this with anybody. It'll be on our YouTube channel. It just takes a while for it to get there, but I promise you it will be if you take a peek. It's always good to be together, and thank you once again for your time and your willingness to just share what you know. Really just very helpful. Thank you, everybody, for your participation. It's always our hope as you go from this place that you be well. Thanks for coming.